Okay, so today we are going to talk about interstitial lung disease. It is a restricted lung disease, which means there is a problem in inspiration of air. There is an increase in FVC FEV ratio. In this disease, there are many different diseases come in this one, and what happens primarily is that there is a destruction of lung parenchyma. The general characteristics of this disease is irreversible fibrosis, distortion of lung, and impaired gas exchange. If you see the patient, the clinical function will be dyspnea, cough, and it is not productive. There is no sputum in the cough. It can be chronic. It is a chronic disease, but it is not malignant. But there is no sputum in the cough. There is fatigue. Now, different types of diseases in this one have different types of symptoms. But for you to diagnose the interstitial lung disease, first you can do is a X-ray. In X-ray, it will show honeycomb appearance of the lungs or ground glass appearance. In the CT scan shows the extent of fibrosis. The pulmonary function test in this one will show there is an increase in the FEV, that is forced expiratory volume, and FVC, forced vital capacity ratio increase. That means there is a problem in the inhalation. The patient can expire properly but cannot inspire properly. The gold standard for this one is the tissue biopsy. You can do it, but it is kind of an invasive process. You can also do urinalysis, and urinalysis rules out our two main diseases that damage our basement membrane, that is Wagner and good pasture. Okay, the treatment for interstitial lung disease is you can give them glucocorticoids, lung transplants, or smoking cessation, and oxygen therapy. Glucocorticoids, it's the basic one you can give them. For there are some diseases in this one which are caused by smoking. You can tell your patient to stop smoking. You can give them oxygen, as there is an impaired gas exchange, so that's why you can give them oxygen. And diseases that come into this one, there are moreover many diseases, but I'm going to discuss only few which are very important for medical students. First is sarcoidosis, histiocytosis, Wagner granulomatosis, Churg-Strauss syndrome, and good pasture syndrome. So what happened in sarcoidosis? There is a non-cassating granulomas formation in our lungs, which shows as a hilar lymphadenopathy. It affects many organs. It is a multi-organ affecting disease. It all affects our eyes, our skin, our heart, and many other. In histiocytosis, you have incoming of histocytes in infiltration of histocytes in our lungs. In Wagner granulomatosis, it is a necrotizing granulomatosis, granulation of vascular structures. It is a necrotizing type, and but it is sensitive for C and K protein, and for that you can use it for diagnosis. Churg-Strauss syndrome is also a vascular disease, but it is not necrotizing like Wagner, and it is sensitive for P and K. Now, good pasture syndrome, in this disease there is an IgG activity in our body which destroys our basement membrane, and that's why you should do urinalysis to rule out this one and Wagner. There are many more diseases, but as you can see, it is a quick review about interstitial lung disease, which will help you to at least get an idea of what it is.